Good morning. I'm George Latimer, Westchester County Executive. It is Friday, May 8th, and where we would normally have our conversations on Facebook Live regarding the COVID outbreak, we have important news to share today, and I wanted to take this time slot to begin the process of outlining it for everyone. We have had, over the last week to 2 weeks, monitoring going on by our healthcare professionals of an outbreak of a matter that we've gotten a health advisory from New York State as of the day before yesterday. It regards pediatric multi-system inflammatory syndrome potentially associated with coronavirus disease, COVID-19. For those of us who are not professionals, this involves a disease that affects young children, may be associated with the COVID-19 outbreak, and a very serious one at that. There were signs in Europe a number of weeks ago, 2 or 3 weeks ago, that this disease was starting to manifest itself, very seriously affecting young children. And then now here in New York State, we've identified that there are 64 cases of it. Important enough for Dr. Howard Zucker, who is the State Commissioner of Health, to issue an advisory. And our own Dr. Sherlita Amler, who is with us here today, she's the Commissioner of Health for Westchester County, and her team have been looking at this over the last week. It has now reached a point at which we want to brief the public on this. And to do that, we brought 3 very capable healthcare professionals to deal with the issue. They'll each speak a bit on this topic, and then we'll open it up to questions. We have with us Dr. Sherlita Amler, who's our Westchester County Health Commissioner, as mentioned. We have Westchester County Health Department Chief of Communicable Disease, Dr. Dial Hewitt, Jr. And we're very happy to have with us Dr. Michael Gewitz, who's the William Russell McCurdy Physician-in-Chief of the Maria Fareri Children's Hospital here in Westchester County, over on the campus of Westchester Medical Center, part of our Valhalla complex. All 3 of these individuals have expertise in some of these complicated areas of medicine and science, certainly beyond layman's understanding of it. But what we do know is that this syndrome has affected a number of young children here now in New York State, and as well as in Westchester County. We want to try to get a handle on this so that when I report at 2 o'clock today on the general status of the coronavirus outbreak, that we can give you some important statistical information. But right now, this is for the public health information function, something that every parent who has children at home should pay close attention to. This is very serious. This disease can be fatal, and we want to make sure that everybody in Westchester County is aware to be on the lookout for the symptoms that may lead to this. So without any further conversation, I'm going to invite Dr. Amler to speak with us, and then in sequence, Dr. Hewitt and Dr. Gewitz. First, Dr. Amler.
Thank you, County Executive Latimer. So I'm here today to talk about a new disease pattern that's come to our attention. Recently, there's been a relatively small number of children who might also be infected with COVID-19 who are having a almost like a post-viral syndrome. So far, some 64 children in New York State have been affected, and including 11 children in Westchester. And in Westchester, we have had more than 50 children hospitalized with COVID since all this started. The new condition has been referred to as pediatric multi-system inflammatory syndrome. And hospital personnel caring for these patients report that the syndrome, which can be severe, can resemble known immune disorders such as Kawasaki disease or toxic shock syndrome. It's too early for us to tell if this new condition is a post-viral syndrome caused by COVID-19 or related to COVID-19 in some other way. And until these questions are answered, it's important to be aware of this syndrome and what to look for. So parents especially need to be alert and to get immediate medical children for their immediate medical attention for their children who are ill, who have the following symptoms. So a persistent fever, meaning a fever that lasts more than 4 days, abdominal pain, which could be quite severe, vomiting and or diarrhea, body rash, which could start on the body and extend to the extremities, swollen hands or feet, so peeling of the surface of the hand, and enlarged lymph nodes. A health advisory about this new syndrome has been sent out to medical providers statewide and also reissued by the local health department to our providers in Westchester. Suspected cases of pediatric multisystem inflammatory syndrome should be promptly reported by providers to the Westchester County Department of Health. And we will continue, the health department will continue to provide updates periodically as new information becomes available. Today I brought with me Dr. Dal Hewitt, who is our Chief of Section of Communicable Disease, to talk about what we as a health department have seen in relation to this new potentially post-viral syndrome and how it may possibly be related to COVID. So Dr. Hewitt.
Yes, thank you, Dr. Amler, and good morning. I think the thing that's most important for us to realize here in our take-home point is that during the early portion of this pandemic, many of us were lulled into the sense of security, if you will, that this did not impact children and that the children that were impacted only had mild illness. And unfortunately, we are seeing that in rare instances, children are impacted in a major way. And as Dr. Amler has already mentioned, it's very important for parents and for pediatricians and for other caretakers and practitioners to be aware of the fact that children can be impacted. One of the important things we want to try to get across today is that the children that are impacted by this post-inflammatory syndrome, at least the ones that we have reviewed with the health department, they have presented most often 4 to 6 weeks after initial exposure was documented. And we know that in some of the households, parents or grandparents or others were diagnosed with COVID and were actually on the record as being positive. And apparently the children did not develop symptoms until 2 to 4 days before presenting to the hospital for treatment. In many of the situations, the children had had symptoms for that 2 to 4 day period, which consisted of things, as Dr. Amler mentioned, like abdominal discomfort, vomiting, in some cases diarrhea. The thing that we would like to get across to everyone is that if your child has been in a setting in which they've been exposed, or even if they haven't been, and if you notice that they have persistent fever that doesn't seem to go away, and if they are exhibiting symptoms like abdominal pain or vomiting, that you should immediately contact the healthcare provider so that your child can be evaluated. It's very important to do that. So I think those are our main messages that we'd like to get across today. Thank you.
Next, Dr. Gewitz, if you would.
Thank you. We have at the Children's Hospital, at Fareri Children's Hospital, had, as the county executive mentioned, 11 children ranging from age as young as a few months to teenage years admitted with this entity, a syndrome. And the syndrome means it's a cluster of findings and symptoms. That's all the word syndrome means. And it is apparently on the heels of some period of time, maybe as short as 2 weeks, or as was just mentioned, as long as a month, after a possible COVID infection involving these young people. This is not acute or sudden onset of COVID disease necessarily, although we have tested every child. They do test positive, but importantly test positive also for the antibodies to COVID-19. Fortunately, and I think one of the other important messages is that while COVID-19 is likely to infect a large number of children, most of whom, or at least many, are totally asymptomatic, this particular complication is relatively infrequent, unusual thus far. And while we have seen a cluster of cases now, in the whole picture of the total COVID experience in childhood, this remains a relatively infrequent possibility. So while it is crucial, as my colleagues have mentioned, that families pay attention to persistent fever, either extreme irritability or extreme lethargy, and the other symptoms that were just reviewed, abdominal pain, skin findings, sometimes some eye findings, a dry, without mucus, red eye picture. While it is very important that those symptoms be discussed with either the family doctor or the pediatrician who's involved with your families, this still is not something that is likely to occur in every child who's had COVID experience. Fortunately, most children, even though they are critically ill for a period of time, thus far in the world's experience, both in the United Kingdom, where this first was figured out as a new cluster, and around our country, have done well. And they do need intensive supportive care, but the long-term outcome is good. We have seen a couple of children as well who have neurologic symptoms, and that may be a variant feature, not as well seen, but any child in this circumstance who also has persistent headache, some unusual kind of weakness in a household where there may have been either exposure known or a mild illness a few weeks before. Also, please discuss that with the pediatrician or the family doctor. But that's our message.
We'll open it up to questions from the press. We're joined by Tony Aiello. So Tony, you get the first question and as many follow-ups as you'd like.
The health commissioner in New York City spoke about this a few days ago and said, thank God in this situation we haven't had any children who have died with this Kawasaki or Kawasaki-like illness. Is it the same situation in Westchester County?
Well, we're investigating the actual numbers now. I don't know if anybody can speak to the current circumstances of what's happening.
Dr. Gewitz would be best.
It is a Kawasaki-like condition, but it is not Kawasaki disease. Kawasaki disease also has an excellent prognosis in the overall setting of the numbers of children who get that illness. And it, just as a way of context, Kawasaki disease, which you may not have heard of before, is the most common cause of children developing heart problems in this country these days. Fortunately, most of those end up doing quite well, as opposed to children who are born with congenital heart problems. We have experienced one loss here in a child with a serious neurologic complications and presentation of this syndrome. But overall, it is quite right to say that the overall prognosis is really excellent. And whether this child, as we investigate further, fits the bill to a picture or had an associated pre-existing condition, we're still trying to assess.
Can you tell us the sex or the age of the child?
That was a young boy. Boys seem to be more prevalent with this complication to begin with. But as I said, our age range has ranged from infants a few months of age to teenagers.
Can I ask Dr. Amler, in terms of reporting to the HERDS system, would this be considered the first pediatric death from this multi-symptom inflammatory syndrome?
Well, I think we're still trying to work that out, and that's for the ongoing investigation to figure out. Certainly, it will be reported as a potential COVID death, and we will just have to continue, which is why it's so important that we get this message out there, because the more cases that we investigate, the more information we have, the better able we are, because the doctors see individual patients and they don't always have the opportunity to see the whole picture. So one of the responsibilities as the health department is to gather all the information and with our physician colleagues and our hospital colleagues to try to determine, are there patterns that can be seen, and if there are patterns, are there ways that interventions could be put into place. So this is the very, very early stages of this look in to see if this even is a true consequence of COVID.
I've covered you for a few years. You usually do a great job putting things in perspective for parents. Obviously, every parent is going to be worried about this, but based on what you've said, it seems to me that some parents need to be a little bit more worried perhaps than others. What is your message to parents who are understandably nervous about this? That if they had COVID in their house with an adult, perhaps they need to be a little more vigilant?
That's exactly right. So if you know you've had COVID positive individuals within your household, and that your children have either tested positive or been exposed to COVID, and then they develop these kind of symptoms that we've talked about, which are rather vague, but is the combination of more than one symptom. And I would stress the persistent fever greater than 4 days, along with these other symptoms that both myself and Dr. Gewitz have discussed, that it's worth you reaching out to your physician, to your family doctor, your pediatrician, whoever takes care of your children, and just say, this is what's going on in my family. I think my child needs to be evaluated, so that someone can make the determination as to, is there further testing that needs to be done, and how does that child need to be managed? Because as Dr. Gewitz said, most of these children have very good outcomes. And obviously the earlier the problem is diagnosed, that we recognize there is a problem, the faster they get into therapy, the better chances for a really good outcome. I think Dr. Gewitz would agree with that.
Sure. These children have generally been hospitalized with the syndrome in the intensive care unit with a full range of support. And it's interesting, relatively quickly seem to emerge from the depths of the problem. So early treatment in a comprehensive setting where the full range of childhood intensive care supports are available is important.
Tony, any other follow-ups?
That's all. Thank you, sir.
Okay, thanks. Let's open it up. Catherine Chaffee is with us here. Do we have any other questions available for us? Okay. So for those who may be watching from the press, we'll be happy to speak with any of you offline. We will be back at 2 o'clock. We'll be updating on a number of different topics. This will now be one of the topics that we're going to look at. And we'll talk to our medical professionals who are here with us and try to get enough of a handle for an update by 2 o'clock. And then we'll monitor this as part of the overall COVID-19 outbreak. So I'm George Latimer, Westchester County Executive. Thanks for tuning in. We'll see you again at 2 o'clock. Have a good day. Stay safe.